walking into a room and forgetting why you went there, losing your train of thought mid-sentence, misplacing your keys more often than usual. For many adults over 50, these moments trigger a very specific fear. You might start wondering if it's the beginning of something serious. You might start looking up symptoms of dementia. But often, the real cause of this brain fog and short-term memory loss isn't age, and it isn't cognitive decline. Instead, the confusion could be sitting right in your medicine cabinet. Many adults over 60 take multiple prescriptions and over-the-counter drugs every single day to manage their health. What is often overlooked is how these common medications interact with an aging nervous system. Waking up exhausted, feeling confused, or experiencing sudden memory blanks can be a direct result of the exact pills you take to feel better. Most people think that memory loss is just a normal, unavoidable part of getting older. They assume that if their memory slows down, their brain is failing. The surprising part is that a significant number of cognitive issues in older adults are completely reversible. The real issue may not be your brain aging faster than normal. Instead, it might be the hidden side effects of common medications that millions of adults take every single day. Many of these drugs are available right over the counter. You don't even need a prescription for them, but they actively interfere with the chemical messengers your brain uses to form new memories and stay alert. Understanding this pattern changes everything about how you look at age-related memory loss. This isn't just an observation. Research suggests that certain drug classes profoundly impact memory and attention in adults over 60. When you take a medication, it doesn't just affect the target organ. Many of these drugs cross the blood-brain barrier. Once inside the central nervous system, they can block essential neurotransmitters like acetylcholine or artificially enhance inhibitory signals like GABA. According to studies published in the Journal of the American Geriatric Society, this interference can rapidly impair short-term memory and executive function. Why it matters is simple. By identifying and discussing these specific medications with your doctor, you can often restore clarity, improve your balance, and regain your sharp memory. We begin with one of the most widely used medications for acid reflux and heartburn. Proton pump inhibitors, like omeprazole and pantoprazole, are taken by millions of adults to suppress gastric acid. The mechanism here is indirect but worth discussing. Chronic acid suppression can interfere with your body's ability to absorb vitamin B12. Vitamin B12 is essential for nerve health and cognitive function. When levels drop too low, it can lead to brain fog and memory issues. While the evidence linking PPIs directly to dementia is still considered weak and observational by many experts, the connection to B12 deficiency is a known pattern. Linda, a 64-year-old patient from our clinical examples, felt completely exhausted and struggled to remember names. She assumed it was early dementia. After reviewing her long-term use of a PPI, her doctor discovered a severe B12 deficiency. The practical action step: if you've taken a PPI for years, ask your doctor to check your vitamin B12 levels. But while PPIs have weak evidence, our next medication acts directly on your brain's language centers. Used for managing seizures and frequently prescribed for preventing migraines, some antiepileptic drugs have well-documented cognitive side effects. Topiramate, in particular, works by dampening overactive electrical signals in the brain. It blocks sodium channels and enhances inhibitory GABA signals. However, this generalized dampening effect can interfere with the brain's language and memory networks. Research published by the NIH shows that memory complaints, slowed thinking, and a very specific issue, struggling to find the right words, occur more frequently with this medication than with many alternatives. Take Linda's experience with a similar prescription for migraines. She found herself pausing mid-sentence, unable to recall common nouns. It was terrifying for her, but completely reversible. The action step: if you take a medication for migraines or seizures and notice new word-finding difficulties, discuss it with your neurologist. There may be alternatives with a lighter cognitive footprint. This is a specific side effect, but the next category affects your entire system. Drugs like prednisone are powerful tools used to fight severe inflammation, from asthma flare-ups to rheumatoid arthritis. The mechanism involves glucocorticoid receptors, which are highly concentrated in the hippocampus, the brain's memory center. Sustained high levels of these steroids can temporarily impair the function of the hippocampus, causing specific defects in declarative memory which is your ability to recall facts and events. Clinical observations note that these cognitive changes are dose-dependent. The higher the dose, the more likely you are to experience mood swings and memory blanks. When Linda was put on a high dose of prednisone for an autoimmune flare-up, her family noticed she became unusually forgetful and easily agitated. Once the inflammation was controlled and the dose was slowly tapered down, under medical supervision, her memory returned to normal. The action step: if you require long-term corticosteroids, stay vigilant about mood and memory changes, especially after a dose increase. While steroids are for inflammation, millions of adults use our next category simply to manage daily pain. Prescription opioids, such as hydrocodone or oxycodone, are potent painkillers. These medications depress the central nervous system by activating opioid receptors. This significantly alters attention, working memory, and executive function. Over time, chronic use can also disrupt your sleep architecture, which compounds the brain fog. According to the Mayo Clinic study of aging, which followed over 4,000 older adults, repeated opioid prescriptions were associated with a measurable acceleration in global cognitive decline, specifically impacting memory and attention. Linda was prescribed an opioid after knee surgery. Weeks later, she was still taking it for residual pain and noticed she couldn't concentrate long enough to read a book. The action step: work with your doctor to use the lowest effective dose for the shortest possible time and explore non-opioid pain management strategies. Pain is a major issue, but so is sleep, and our next two categories are often taken right before bed. Medications like zolpidem are marketed as sleep aids with fewer side effects than older sedatives. They work by enhancing GABAergic inhibition in the brain, essentially forcing the brain to slow down and sleep. However, this profound sedation can severely impair your working memory and psychomotor function if you wake up during the night. Studies show that taking a Z drug significantly increases balance failures and causes acute confusion during nighttime awakenings. Older adults are particularly vulnerable to falls and memory blanks in the dark while under the influence of these drugs. Linda once took a Z drug to help her sleep. When she woke up to use the bathroom at 2 a.m., she was completely disoriented and nearly fell. She had no memory of the event the next morning. The action step: if you use a prescription sleep aid, be extremely cautious about getting out of bed during the night. Ensure your path to the bathroom is clear and well lit. But while Z drugs are risky, an older class of sedatives is far more concerning for your memory. Medications like lorazepam, diazepam, and alprazolam are frequently prescribed for anxiety and severe insomnia. Like Z drugs, they act as powerful positive modulators of GABA receptors. This generalized depression of the central nervous system severely disrupts the encoding of new information, leading to anterograde amnesia, meaning you struggle to form new memories while the drug is active. A massive review of 68 trials showed that benzodiazepines consistently induced memory and attention impairments, with the largest and most dangerous effects seen in adults over 65. The American Geriatric Society lists them as drugs to avoid in older patients. When Linda was prescribed a benzodiazepine for anxiety, her family noticed she would repeat the same questions multiple times an hour. The action step: if you have been taking a benzodiazepine long-term, do not stop abruptly. Speak to your doctor about a safe, gradual tapering plan. The next medication isn't for sleep or anxiety, but for a completely different nerve issue. Older antidepressants, like amitriptyline, are now commonly prescribed for nerve pain, migraines, and insomnia. The problem is their strong anticholinergic properties. They block muscarinic receptors in the brain. Your brain needs the chemical acetylcholine to maintain attention and form short-term memories. By blocking it, TCAs essentially turn down the dial on your cognitive sharpness. Experimental studies have shown that amitriptyline produces an age-related impairment in memory, selectively disrupting verbal recall. In older adults, this can mimic the symptoms of early dementia. Linda was taking a low dose for neuropathic pain. While her pain improved, she started leaving the stove on and forgetting appointments. The action step: if you take a TCA for nerve pain and notice worsening memory, ask your doctor if a medication with a lower anticholinergic burden might work for you. This anticholinergic effect is powerful, and it's the exact reason our number 2 medication made the list. Medications like oxybutynin are frequently prescribed to treat an overactive bladder. These drugs calm the bladder spasms by blocking muscarinic receptors. However, oxybutynin readily crosses the blood-brain barrier. Once inside the brain, it antagonizes the exact same cholinergic transmission in the hippocampus that you need for learning new things. A randomized trial found that oxybutynin ER produced significant memory deterioration compared to a placebo. In fact, researchers noted the cognitive effect was comparable to 10 years of normal brain aging. Linda started taking oxybutynin for urge incontinence. Within weeks, her short-term memory declined so sharply that her daughter scheduled a neurology evaluation. The action step: if you take a daily medication for an overactive bladder, review it with your doctor. There are newer alternatives that do not cross into the brain as easily. But the absolute highest risk medication for your memory might be sitting in your bathroom cabinet right now, and it doesn't even require a prescription. First-generation antihistamines, like diphenhydramine, are the active ingredients in Benadryl and almost every over-the-counter PM sleep aid and cold medicine. Of all the medications on this list, these have the strongest, most convergent evidence linking them to memory problems, delirium, and long-term cognitive risk in older adults. They are highly potent anticholinergics that flood across the blood-brain barrier, aggressively blocking the acetylcholine your brain desperately needs. Major clinical organizations, including the Cleveland Clinic and the Mayo Clinic, explicitly warn against using these drugs in older adults. Studies show that a high cumulative burden of these OTC drugs is associated with reduced brain metabolism, smaller hippocampal volumes, and a significantly increased risk of incident dementia. Linda had been taking a store-brand PM pain reliever every single night for years to help her sleep. She had no idea she was suppressing her brain's memory centers night after night. The action step: check the labels of your over-the-counter sleep aids and allergy pills. If you see diphenhydramine, talk to your pharmacist about safer, non-sedating alternatives. If you recognize any of these medications in your daily routine, do not panic. And absolutely do not stop taking your prescribed medications suddenly. Instead, take a simple, low-friction approach. Write down every prescription, over-the-counter drug, and supplement you take. Schedule a dedicated medication review appointment with your primary care doctor or a geriatric pharmacist. Ask them one specific question. Are any of these medications increasing my anticholinergic burden or affecting my memory? If you found this breakdown helpful, make sure to subscribe to Truewell Prime. We are building a library of clear, evidence-based health information specifically for adults over 50, so you can confidently take control of your health. Remember, this video is for educational purposes only. It is not medical advice. Always consult your healthcare professional before making any changes to your medication regimen. For Linda and for thousands of older adults, the fear of cognitive decline is very real. But once her doctor safely adjusted her medications and removed the heavy anticholinergic burden, her brain fog lifted. She got her memory back. You deserve to have all the facts about what goes into your body. By understanding how these medications interact with your aging nervous system, you aren't just protecting your memory. You are actively preserving your independence.